So with venom allergy, there's actually about 40 to 100 deaths annually in the US, and about half the patients who die do not know that they actually have an allergy. And about 10% of individuals develop what we call large local reactions, and anaphylaxis is reported to venoms in about 0.3 to 3% of the general population. So the signs and symptoms of anaphylaxis can vary. They can include multi-organ systems, such as the central nervous system with lightheadedness, syncope, respiratory system with shortness of breath, wheezing, GI system with diarrhea, vomiting, skin certainly with hives, and also with swelling, for example, of the throat, the lips, such as angioedema. So it can really be a multi-system approach that is involved in anaphylaxis. Now there's different family classes when we look at Hymenoptera. So we have one family known as the Apidae bees, so this includes the honey and bumblebees. We have the Formidae ants, which includes fire ants, and the Vespidae wasp includes the category of paper wasps, yellow jackets, hornets, and so these are different categories of venoms in how we examine them. So it's really helpful if the patient does have some kind of reaction of venom. Are you able to identify which insect stung them? Sometimes it's hard because it happens real quickly, but if a patient is able to provide any history on identification of what was involved, that can be really helpful. So there's just some common types of things like honeybees, yellow jackets, paper wasps, and fire ants. Now let's talk about the classification of insect sting reactions, because that helps guide on whether someone should be evaluated or not. So you can have what we just consider a normal reaction, where you have some pain, itching, for example, at the sting site. That can be immediate, local, transient. We can have something called a large local reaction. So you can have, for example, if you were stung on the finger, maybe your hand can get swollen or red. There's the systemic, what we call the severe allergic reaction, which can be immediate, generalized, again, the symptoms of anaphylaxis that I went over. And there's some other kind of different forms of reactions where people can have a serum sickness or neuropathy. And so knowing what kind of class of reaction is important.